Hello, my name is Kenny Lopez, and I will be doing a presentation on AIDS. What is AIDS? Acquired immune deficiency syndrome, also known as AIDS, is the final stage of HIV. HIV is the virus that causes AIDS. AIDS is a condition that occurs when HIV has done too much damage to the immune system. This limits the body's ability to fight infection due to the markedly reduced helper T cells. An estimated 940,000 people died from AIDS-related illnesses in 2017 alone. The CD count is like a number that shows how well the immune system is functioning. CD4 cells are white blood cells that fight infections. These cells are the ones that HIV tries to kill. When the CD4 count drops below 200, a person is now diagnosed with AIDS. The normal range of CD4 cells is about 500 to 8,500. Common risk factors. A risk factor is something that makes the chances of getting a disease higher. The most common risk factor for contracting AIDS is having unprotected sex. However, there are other factors that can increase the chances of one getting this disease. One's chances become higher if one is a male having sex with other males, or one has multiple sex partners, or one is having sex with someone who is having sex with multiple other people. Also, living or working in a place where HIV infection is common can increase one's risk. These are people who work in healthcare, prisons, or labs. Having an uncircumcised penis also puts one at greater risk for contracting AIDS. Many junkies also catch this disease since the smallest amount of blood with HIV can be passed on to someone. Sharing needles can infect one another. One can transmit disease at any given time, even if no symptoms are present, so it is very important to get checked by your healthcare provider regularly. Symptoms. Some symptoms of AIDS include rapid weight loss, recurring fever and night sweats, extreme and unexplained tiredness, prolonged swelling of the lymph glands in the armpits, groin, or neck, diarrhea that lasts for more than a week, sores of the mouth, genitals, or anus, pneumonia, red, brown, pink, or purplish blotches on or under the skin or inside the mouth, nose, or eyelids, memory loss, depression, and other neurological disorders. Each of these symptoms can be related to another illness. The only way to know for sure if one has HIV is to get tested. Many of the severe symptoms and illnesses of HIV disease come from an opportunist infection that can occur because the body's immune system has been damaged. The signs and symptoms are those of the presenting illness, meaning that HIV infection should be suspected as the underlying illness if an unusual infection presents in a healthy individual. Diagnosis. To diagnose AIDS, the doctor will need first a confirmed positive test for HIV. Second, evidence of an AIDS-defining condition or severely depleted CD4 cells. Current guidelines recommend that the first step is a screening test. This looks for the component of the virus. This is called P24 antigen, as well as antibodies working against HIV. Specimens for the test can be from blood obtained from a vein or finger stick, an oral swab, or a urine sample. The results can come back in minutes or take several days. It depends on the method that is used. If the screening HIV test is positive, a different test that looks for antibodies to either HIV-1, the most common form of the virus, will confirm the results. If one of these tests is positive, it confirms infection with the particular type of HIV. However, having HIV does not mean that one has AIDS. AIDS happens when there has been a lot of damage done to the immune system. The evidence comes from at least one of the following: the presence of an AIDS-defining condition measuring the CD4 cells in the body showing that there are fewer than 200 cells per millimeter of blood, or a laboratory result showing fewer than 14% of lymphocytes are CD4 cells. However, any diagnosis of AIDS requires a confirmed positive test for HIV. Treatment. There is no cure, unfortunately, for HIV or AIDS, but there are many different drugs that are available to control the virus. Such treatment is called antiretroviral therapy, ART. Each class of drug blocks the virus in different ways. ART is now recommended for everyone regardless of the CD4 T cell count. It's recommended to combine 3 drugs from 2 classes to avoid creating drug-resistant HIV strains. The classes of anti-HIV drugs are non-nucleoside reverse transcriptase inhibitors. These turn off a protein needed by HIV to make copies. Nucleoside or nucleotide reverse transcriptase inhibitors. These are faulty versions of building blocks that HIV needs to make copies of itself. Protease inhibitors. These are inactive HIV protease, another protein that HIV needs to make copies of itself. And lastly, entry or fusion inhibitors. These block HIV's entry into the CD4 T cells. Treatment can be difficult. HIV treatment plans may involve taking several pills at specific times every day for the rest of one's life. Each medication comes with its own unique set of side effects. Some of the treatment side effects may be nausea, vomiting, diarrhea, heart disease, weakened bones, bone loss, abnormal cholesterol levels, higher blood sugar levels, and breakdown of muscle tissue. The doctors will monitor the patient's viral load as well as his CD4 T cell count to determine the response to the treatment. The CD4 T cell count should be checked every 3 to 6 months. The viral load should be checked before treatment and then every 3 to 4 months during therapy. Alternative medicine. Along with receiving medical treatment, it's essential to take an active role in one's own care. One should try to eat healthy food, avoid raw meats, eggs, and get all the proper vaccines. Alternative medicine is also available. Things such as supplements may be helpful. Early evidence suggests that whey protein, a cheese byproduct, can help some people with HIV gain weight. It also appears that it helps reduce diarrhea and increase CD4 T cell counts. Supplements that may be dangerous are St. John's worts and garlic supplements. Although garlic itself may be helpful to strengthen the immune system, garlic supplements interact with several anti-HIV drugs and reduce their ability to work. Facts. As the mid-2016, 18.2 million people were receiving ART worldwide. In 1996, the total life expectancy for a 20-year-old person with HIV was 39. In 2011, the total life expectancy bumped up to about 70 years. In fact, women are at least twice as likely to contract HIV through vaginal sex with infected males as vice versa. The first case of AIDS was reported in the U.S. in June 1981. Every 9.5 minutes, someone becomes infected with HIV in the U.S. Advances in treatment have substantially reduced AIDS-related deaths and extended the lives of many Americans with HIV and AIDS today. Thank you.